If you or someone you care about is dealing with an overactive bladder, you already know how much it can impact daily life. So today, we're going to pull back the curtain on one of the main medications used to manage it, Tolterodine. We're going to get into what it is, exactly how it works, and everything you need to know to have a really productive chat with your doctor.
Okay, so before we can even talk about the solution, we've got to get on the same page about the problem itself, right? What is overactive bladder, or OAB, anyway? Because it's a whole lot more than just needing the bathroom a lot. It's a very specific group of symptoms.
All right, let's dive right into the heart of the problem. Overactive bladder isn't just a vague feeling. Nope, it's actually defined by 4 core symptoms that really create that frustrating cycle of, well, urgency and frequency.
So you can see it's really a package deal, a syndrome defined by these 4 key things. And you might be wondering, what's causing all of this? Well, the root cause is involuntary contractions of the bladder's main muscle, called the detrusor muscle. Basically, it's squeezing when it's not supposed to be, and that's what leads to that sudden gotta go now feeling, all those trips to the bathroom, and sometimes even leaks.
Okay, so we've got the problem nailed down, a bladder muscle that's just a little too active. Now let's switch gears and talk about the solution. How does a medication like Tolterodine actually step in and bring some relief?
To really get how this medicine works, we first need a super quick look at how a healthy bladder does its job. It's actually a pretty neat 3-step process. Your brain sends out a chemical messenger, acetylcholine. That little messenger travels down and finds a specific parking spot, a receptor, on your bladder muscle. Once it parks, boom, it tells the muscle to contract and you urinate. Simple, right? Works like a charm when it's supposed to.
And this is where Tolterodine becomes the hero of the story. Think of it like this. The medication gets to your bladder muscle and pretty much takes up all the good parking spots. So now when the brain's signal, that acetylcholine, shows up ready to work, there's nowhere for it to park. Since it can't connect with the muscle, the signal to contract gets blocked. And the result? The bladder muscle just stays calm and relaxed.
So what does all that mean for you? Well, the result is what really matters here. By keeping that bladder muscle chill, Tolterodine directly fights those OEB symptoms we just talked about. Your bladder can physically hold more, those annoying involuntary squeezes happen way less often, and that constant feeling of urgency and frequency starts to fade.
All right, so we know how it works on a chemical level, but what about the practical side? How do you actually use it? Let's get into the user manual, so to speak, and look at the different forms and dosages. Tolterodine basically comes in 2 flavors. You've got the immediate release, or IR, which you take twice a day. Then there's the extended release, or ER, which is just a once-a-day pill. Now, the ER version is usually the go-to. It's not just more convenient, I mean, who doesn't prefer 1 pill to 2, but it also gives you a much more stable, steady level of medicine in your body, which means better symptom control around the clock. And this is super important to remember. The dose is not one size fits all, not at all. How well your body processes things is a huge factor. So if you have any issues with your liver or kidney function, your doctor is almost certainly going to start you on a lower dose. It's all about making sure it's both safe and effective for your body.
Okay, with any medicine, you have to look at the whole picture. And that, of course, includes potential side effects. So let's be upfront and talk about the trade-offs so you know exactly what to expect.
But before we just list them out, it helps to understand why they even happen. Remember those parking spots, the receptors that Tolterodine blocks in the bladder? Well, guess what? Your body has those same kinds of receptors in other places too, like in your salivary glands, your gut, and your eyes. So side effects pop up when the medication blocks those other receptors as well.
And yeah, as you can see, dry mouth is the big one. It's by far the most common side effect, and it makes perfect sense, right? Tolterodine is also blocking the receptors in the glands that make your saliva. By that same token, it can cause constipation because it's slowing things down in your digestive tract, and it can cause dry eyes by cutting down on tear production.
Now, it is absolutely crucial to know the difference between those common, manageable side effects and the really serious stuff. While these are rare, things like a major allergic reaction, sudden confusion or hallucinations, a racing heart, or really bad stomach pain, those are red flags. If you experience anything like that, you need to get in touch with your doctor immediately.
This brings us to our final and maybe most critical section, the safety check. This is all about knowing who needs to be extra careful with this medication, so you can be your own best advocate.
So let's ask that question directly. Who is this medication potentially risky for? We're about to break down who shouldn't take it at all and who needs to be under very close medical supervision if they do.
Let's start with the hard stops, the absolute no's. If you have any of these conditions, Tolterodine is not for you. I mean, think about it. If you already have a hard time emptying your bladder, taking a medicine that relaxes it even more could make things much worse. The same logic applies if your stomach empties too slowly or if you have uncontrolled glaucoma.
Now this here is the proceed with caution list. It's not a total ban, but these situations require very careful management. For instance, older adults can be more sensitive to side effects like confusion, so the rule is to always start with the lowest possible dose. And like we said, anyone with liver or kidney problems is going to need a specific dosage adjustment. This is exactly why being totally open with your doctor about your entire health history is so important.
Phew. Okay, we have covered a lot of ground. So let's bring it all home and boil it down to the most important things you need to remember from all this.
If you only remember one single thing from this entire explainer, please let it be this. Tolterodine is an amazing tool for managing the symptoms of OAB. It can give you back a ton of control and relief, but it doesn't actually cure the root cause of why the bladder's overactive to begin with. So, one last time, let's do a super quick recap. Tolterodine works by relaxing your bladder muscle. Its #1 side effect is dry mouth. It's a powerful and effective medication, but it's definitely not safe for everybody. And that's why you must discuss your full medical history with your doctor before you start taking it. And that really leaves us with the final, most important question. And it's not for me to answer, it's for you to discuss with your doctor. Now that you're armed with all this info, you can have a much more confident, informed conversation to figure out if Tolterodine is the right choice for you. Thanks so much for joining me.